Okay, thank you very much. It is my honor that I can introduce this round table on the Liver Cancer Awareness Day, because I think the topic is very important and very timely. Uh, so, as you know, that healthcare, which has traditionally been a marginal competence, a marginal issue in the Brussels bubble, has become much more important in the last several years. But unfortunately, this importance is declining. So after the cessation of the COVID-19 pandemic, definitely we see that other topics have become more of a priority, more of a focus here in the European institutions, and that healthcare is not as talked about as, let's say, 2 years ago. So definitely what is important is to keep the momentum going. It is important that we keep the discussions, that we focus on other areas which have not been so much discussed in the last several years, because I believe that EU can do much more than it is doing now in tackling the problem, for instance, of liver cancer. Why liver cancer is, I think, a very good example of what EU can do. So the problem with the healthcare in EU is that it is primarily a national competence. So organization, funding, and management of healthcare systems is power of the member states, while EU can only support national policies. However, in the area specifically of prevention, we have a lot of tools, specific tools, which have maybe not even been designed originally for public health objectives, but can definitely be used to a significant extent to tackle the problems that we have with certain diseases like liver cancer. When I speak about liver cancer is definitely a major public health issue. I think this is something that needs to be mentioned very strongly. So it is the ninth most frequent cancer type in Europe, with over 87,000 new cases diagnosed, for instance, in 2020. And it is the seventh most common cancer-related cause of death, accounting for over 78,000 deaths for a year in Europe, also for 2020. So this is the data that I have. So definitely, major health issue, one of the most prevalent cancers, and one of the leading causes of death in Europe. So definitely, this is a reason why we have to go. And why did I emphasize prevention? Because this is one of the types of cancer when prevention is maybe the most important. So it's not all the same. So different types of cancers depend on different factors and different variety of factors. Some are more preventable than the others. But I think when you speak about liver cancer, here, the question of prevention, the question of eating habits, of drinking habits, of general way of living has definitely a very strong role to play. And here, in the area of prevention, EU can do most, because we already have legislation in force on consumer protection, for instance, on the information that consumers need to receive about the food they eat, the rules on advertising of alcohol, for instance, etc. Also rules on taxation of alcohol. So we already have a lot of the rules which are already in place, which can be used to much more significant extent, actually, with this public health objectives in mind. So in that sense, this is also one of the reasons why Europe's Beating Cancer Plan puts so much emphasis on prevention. So essentially, in prevention, we can do most with the powers that EU has, while in the area of treatment and funding of healthcare and coverage of health insurance, etc., we have much less room to maneuver on the European level. So what can we do on European level? So as I already mentioned, the question of alcohol consumption is very important. We are waiting for the Commission to come up with a proposal on indirect taxes related to alcohol, also tobacco, which is usually mentioned as the most important factor, but alcohol is also as important. It seems that we will not be able to have this within this mandate, but we believe that that this should definitely be one of the most important priorities for the next Commission. So the way how alcohol is taxed, how alcohol is advertised, etc. This is something that definitely should be regulated more clearly on European level than it is now. Also, one thing which is in addition to alcohol, which is I believe very important when you speak about liver, is also the question of eating habits. So eating habits are a big topic in the European Union, in both of the committees that I'm the member of. So as you know, I'm the member of the Internal Market and Consumer Protection Committee. I'm the vice chair there, but also EPP coordinator in the Public Health Subcommittee. And in both of these committees, we speak a lot about food labeling, about eating habits, and about information that the consumers need to get when buying food. And this is something which is very important also when we speak about public health consequences, for instance, relating to liver as well. So in that sense, I've been advocating since the beginning of the mandate that we have strong rules on labeling of food. That we need the mandatory front of pack nutritional labeling, which would mean that consumers would get at the front part of the package of the food they are buying, they will get much clearer information than they are receiving now. And I believe that this is very important. So informing the consumers about what they are eating is a major cause and major factor when influencing their eating habits and eating decisions, which definitely also has an impact on liver cancer as well. So these are concrete things that I've been working on in the parliament, and where I believe that we can do much more. We've been putting pressure on the commission, but as you know, the parliament cannot propose its own legislation, so we have to wait for the commission proposals. But we are putting strong pressure on the commission that these two legislative proposals on alcohol and on front of pack nutrition and labeling of food is put, we hope, at the beginning of the next mandate. Of course, other factors where you can do a lot are, for instance, the question of vaccination, especially so precisely for hepatitis B virus, which definitely affects liver to a significant extent. Here, national policies relating to that are member state competence, but I believe that EU can also contribute and can help by spreading best practices, by providing financial incentives, organizing projects of informing people of the benefits of vaccination, and funding public health campaigns, which are very important if we want also for people to be much more aware of the possibilities of vaccination that they have at their disposal. In addition to that, so these are concrete things. In addition to that, I'm glad that you're also developing European health data space, and I'm also working on the pharmaceutical package. So the idea of European health data space is that we will be able to get healthcare much faster, much more efficient than we have now, because data will be shared, health data across borders of the member states. Also, we'll be able to use data sets from different member states to develop new medicines, new medical technologies to much more significant extent than we are doing now. And this is something that is very important for the patients also suffering from liver cancer as well, because we will be able to create and develop new medical technologies to tackle liver cancer as well. Also, I'm working on the pharmaceutical package, which I think is also very, very important. So we are revising after more than 20 years the set of regulations and directives which regulate putting of new medicines on the European market. And here we want to achieve two things. So we want to stimulate innovation on one side, but we also want that medicines get much faster to all European patients at the same time. So this is very important. So that both patients in Bulgaria, Croatia, Slovenia get new medicines at the same time as and vaccines, for instance, as patients in Germany, Sweden, France, the Netherlands, etc. So this is what will be my focus, and what is my focus while working on this package of new pharmaceutical legislation. And I believe that also for patients suffering from liver cancer, this is something that will be very, very important, especially in those member states where we have problem of access to new medicines. So to sum up, thank you for inviting me. I'm sorry that I will not be able to stay longer, because I have other events and other conferences on healthcare that I need to attend to. So one, which is starting in a few minutes, is about cardiovascular diseases. So definitely a lot of topics on cancer, but other health-related issues as well. We are, as I said, trying to keep this momentum going. So we are trying to keep the momentum that healthcare is discussed as one of the primary focuses of European institutions. And I will continue to work in that sense and to promote the importance of healthcare, importance of public health in the European Union, but also to put pressure, especially on the European Commission, to come up with and propose new legislation. And also, I hope that we'll be able to finish the legislative work that we are now conducting on European Health Data Space, and at least to finish one phase of this pharmaceutical package, so that we make sure that that new treatments are developed much faster and much faster than they are developed now, but or that also new medicines, new treatments, and new medical technologies reach the patients in all European member states at the same time. So thank you very much. Thank you for inviting me. As I said, I will have to leave for the cardiovascular conference, but my assistants will be closely following what you will be discussing, and I will be also glad to get the conclusions of this roundtable, and also we will try to disseminate it as much as possible and work and see what of this can be implemented in the future. So thank you very much.
Thank you very much, Dr. Sokol, member of the European Parliament. Thank you for your continuous support for our activities and having a wide open door for our patient communities to discuss with you what is important in the healthcare space.
Yeah, if I may just,
yes.
if I may just comment, I'm also glad that I can say that your association is one of the most active health associations and health stakeholders in the European institutions, in contacts with European institutions. We've been collaborating very closely in the last years, and I hope that we continue with this collaboration in this mandate, and maybe, who knows, also in the next one.
Yes, hopefully also in the next mandate. Thank you very much, Dr. Sokol. Sometimes this is like a dance, you know, we are dancing a waltz, and then other times we are dancing a tango where we are like stretching the topics and trying to improve the health of patients. But thank you for your continued support, and hopefully in the next mandate we can also work as closely as we did now. I will now just go and do also an introduction from my side. So we were very happy to receive a wide range of interest from the decision makers. So we have we gathered at least 6 members of the European Parliament stating their opinions and setting the scene for everything that needs to be done. But from my perspective, very warm welcome to this high-level roundtable discussion. It's an honor to be here today and to address this critical and pressing issue that affects the lives of many individuals, so-called liver cancer. As we convene for this roundtable discussion, we can recognize the urgency and importance of the advancing of our understanding, raising awareness, and advocating for improving strategies to fight against this disease. Liver cancer often develops very silently, without symptoms that would be manifesting, and they are manifesting at the very advanced stages. So this makes early detection very challenging. Factors such as chronic viral hepatitis, cirrhosis, alcohol-related liver disease, fatty liver, they all contribute to the increased risk of developing liver cancer. So it's imperative that we focus not only on treatment modalities, but also on preventive measures, including vaccination, lifestyle modification, and regular screenings. Today, we come together to address these specific challenges and explore the collaborative strategies to enhance patient care and support. This roundtable discussion will serve as a platform to foster collaboration between healthcare professionals, researchers, patient advocates, and at most also policy makers. By working together, we can address the multifaceted aspects of liver cancer, all the way from prevention and early detection to innovative treatments options that are available and supportive care. As we delve into the complexities of liver cancer, let us remain committed to overarching goal of improving the lives of those who are affected by this disease. Through collective efforts, we can pave the way to a future where liver cancer is not just only treatable, but ultimately also preventable. So we will start a roundtable discussion with first seeing contributions from members of the European Parliament. We will see a contribution from Estrella Dura Ferrandis, and then following by the contribution by member of European Parliament Lyudmila Novak. And then I will just give the floor to the head of ELPA Brussels office, Beatrice Credi, to lead us in the roundtable discussion. Thank you very much.
The European Beating Cancer Plan constitutes a political commitment at all levels and one more step towards better prepared healthcare systems and better social justice in the EU. From the European Parliament and the S&D Group, we are committed to promoting European strategies to fight liver cancer through prevention strategies, early detection, diagnosis and treatment, and the quality of life of patients. We fight for the reduction of related risk factors such as smoking, poor diet, lack of physical activity, and exposure to environmental carcinogens. Also, for promoting vaccination against the hepatitis B virus to prevent liver cancer. We work to ensure that all cancer patients have access to accurate diagnosis and high-quality treatments. This involves promoting multidisciplinary care and improving patients' quality of life during and after treatment. This also involves providing long-term support and improving the quality of life of patients who have survived cancer and those who are in advanced stages of disease. This includes palliative care, psychological support, and rehabilitation. It's also important to eliminate barriers to healthcare. This is why we, socialists, defend a public, universal, and free healthcare system, ensuring that all people have the same right to high-quality care, diagnosis, and treatment, as well as the same access to medicines and the same life expectancy regardless of social origin.
Ladies and gentlemen, on World Cancer Day, we come together to recognize the global challenge of liver cancer. The Europe Beating Cancer Plan is our pledge to tackle this challenge through comprehensive action in prevention, treatment, and care. Liver cancer demands specific attention due to its unique risk factors and late diagnosis. Prevention, including lifestyle changes, hepatitis B vaccinations, and awareness campaigns is key. Equally important is early detection, which we must support through screening and accessible diagnostic tools. We cannot ignore the healthcare inequalities that affect liver cancer outcomes. It is imperative we ensure equal access to prevention, screening, and treatment for all. International collaboration and increased research funding are critical to improve our understanding and management of liver cancer. I urge my fellow MEPs and stakeholders to support the Europe Beating Cancer Plan and dedicate resources to make a real difference in the fight against liver cancer. Together, we can transform our commitment into effective action. Thank you.
Thank you, Marco, for the introduction. And before delve into the topic, I would like to briefly present the people who join us today. Richard Price, Head of Policy, European Cancer Organization, together with Silvia Romero, Policy Officer, always European Cancer Organization, and then Alessandro Gallina, Policy Manager, European Public Health Alliance, Gertrude Buttigieg, Chairperson, Malta Health Network, Lily Anna Gundelach, Medical and Scientific Project Coordinator, Digestive Cancer Europe, and Marco Greco, President of the European Patient Forum. The complexity and variety of liver cancer risk factor need to be addressed considering many fields of expertise and many fields of advocacy. The variety of guests today, the one that I have just introduced, reflect this complexity and strive to advance the discussion, improving liver cancer prevention and early detection in Europe. I would like to start with the president of the European Liver Patient Organization to set the scene by discussing two topics that we think that we need to keep in mind as a sort of common ground when while discussing liver cancer risk factor: inequity and prevention. Regarding inequity, Marco recently co-authored a paper on inequities in primary liver cancer in Europe. And I would like to hear briefly an overview of the state of the play on this topic.
Thank you very much, Ms. Grady. So I will try to sum up the evidence that we gathered in this paper. So a big shout out to the authors of the paper, Professor Kundili, Lazarus, Jepsen, Murray, Schattenberg, Craxi, and Butti. And we were just looking at inequities in primary liver cancer in Europe and the current state of play. It looks like that we are standing in a critical juncture in the fight against liver cancer in Europe. As the burden of this disease continues to grow, so it's imperative that we turn our attention to how to tackle that, incidence and treatment outcomes. Evidence has consistently shown that vulnerable and marginalized populations, those with low social economics and educational backgrounds, are affected by hepatocellular carcinoma and the most common form of primary liver cancer. Factors such as limited access to hepatitis B vaccination, insufficient viral hepatitis screening, restricted treatment options, they show these disparities. Additional lifestyle-related liver disease, they are heavily influenced by social economic conditions that they contribute significantly to the liver cancer burden across Europe. So inequities are not only present in the incidence of liver cancer, but also in the mortality rates that are associated with cirrhosis, with the highest fatalities occurring in social economical disadvantaged areas. Moreover, the complex healthcare systems, coupled with stigmatization and discrimination, they hinder access to necessary care, especially for the key populations. We need to address these issues, and we need to embark on the multifaceted approach, promoting preventive measures, raising public awareness, implementing target outreach programs. These are some of the essential steps if we want to reduce liver cancer incidence. We must also strive to eliminate barriers to accessing care, whatever they be financial barriers, linguistic, cultural, geographics. So the establishment of, for example, in paper, we propose a European Cancer Inequities Registry that would mark a significant step forward in monitoring liver cancer disparities. However, of course, more needs to be done. Our policies and initiatives, they must be evidence-based. They must be focused on expanding access to quality healthcare, supporting community-based intervention, and critically addressing the social determinants of health heads-on. So in closing, let us against liver cancer is not just a medical challenge, but a social one. So by coming together, sharing the knowledge, and committing to equitable health for all, we can pave the way for the future where liver cancer, it's no longer discriminating based on where you live, your economic status, or your educational background. Thank you very much.
You mentioned prevention. You even mentioned target prevention. In most cases, we know that liver cancer can be prevented because its risk factor can be prevented. We can even state that prevention is the best cure that we have. However, if we look at the spending on preventive healthcare in the EU, the range is between 1% and 5.6%. Of the total of the healthcare expenditure. These are data from the 2020. We can say that the level of the investment is low, but again, that there are huge differences between these investment among member states. And here, at least from, we know from the liver patient perspective, we know that it's very difficult to convince decision makers on the topic of investment in prevention, but it's also difficult to convince the general public. So in your opinion, how can we upscale the investment in preventive measure in the EU?
So that's a very difficult and tough question. So I think that we gathered here today and got the impression from several different decision makers that this topic is important. And as a high level opinion makers here around this round table, we can really show that for the future is important, especially for liver cancer, that we are focused on having the amount of budget that would be necessary to implement the screening programs that are necessary for early detection, because overall early detection has the possibility in liver cancer to significantly lower the cost for healthcare system in the future. So this is one topic that we can really address.
Could mention many ongoing initiative at the EU level, and I would like to start talking about some of them. Like to involve in the discussion. Richard and Sylvia, please feel free to compliment on the answers. The European Commission, less than 1 month ago, published the text of a proposed Council of the EU recommendation, specifically on vaccine preventable cancers. The recommendation, not a legal binding piece of legislation, but aims to assist the member state in working together to address cancer risk associated with human papillomavirus infection and hepatitis B infection. We know that hepatitis B infection may cause liver cancer. So I would like to ask the priorities that member states should take into consideration to upscale HBV vaccine.
Well, sure. But firstly, I think, you mentioned about council recommendations, and yes, they're not legally binding, but I really would emphasize to everybody who maybe, for people in Brussels, we're very familiar with what council recommendations are, but for outside of Brussels, to understand the power that they have, because what they represent is all member states, 27 member states, signing up to goals, to sets of instructions to themselves, but also giving instructions often to the European Commission as well on the topic. And what those recommendations that have been published represent is a really important allying of on an already existing EU goal on HPV cancer elimination, and bringing hepatitis in amongst that as well. So, and we've seen what that's done for HPV elimination across Europe. Countries have really accelerated their vaccination programs as a result of having an EU goal. So I think it's going to be a very powerful tool. And the other point to understand about it is it's a proposal from the Commission, which is currently being looked at by member states. So it's a very open process still, and we're at the European Cancer Organization working with yourselves at ELP and many others in our Vaccines Preventable Cancers Network to provide additional recommendations for those for that document. So certainly would encourage all stakeholders to engage in that process as they can. But in terms of your question on what is it that can be done by member states to boost the vaccination rates, well, number one, I think, and this is recognised in the Commission text, is make sure that the vaccination is free of cost. That's a very important thing. Secondly, I think you've got to look at the targeting. And it's, of course, number one, newborns. There's still a lot to do across member states in that field in itself, but also making sure that you've got processes in place to target vaccination to key at-risk groups. And that could be, for example, people who inject drugs, people in prisons, migrants, many others. So, and it's those sorts of things. We've seen this in the HPV field as well, is where there's maybe good practices about how you can reach at-risk groups that can be shared across countries. Can be seen to work. And very much in that domain is how you record the information, making sure you've got good vaccine registries that are reporting the uptakes in real time. And something, it's great to see this in the Commission text, is we saw during the COVID-19 pandemic, there was great work done by the European Centre for Disease Prevention in having real-time recording of COVID vaccination. And we think, well, it works so well in directing the response on that particular topic. Why not extend that to HBV and HPV as well? So that's in there as a point of principle, and that will ensure all countries have good process recording into that central system. And finally, I think we've also got this shared problem across Europe about how to tackle vaccine hesitancy. But here again, you can see really different levels of that problem according to the country. So in Nordic countries, you've got generally with the government and vaccine hesitancy not such an issue. In Europe, where it is a major issue, and I think that's where we can be smart and clever about targeting EU funds to those areas in need, learning from other, like what we've been learning for HPV. But that is a common problem, and what we're seeing works well is working with communities, working with schools, teachers, everyone who's involved in the general ecosphere of creating trust around vaccines. So those would be the sort of 4 key points I would promote most heavily to member states.
It's very important that you mention also adults, because there is this kind of, I would say, misconception. It's not a misconception, it's certainly a lack of knowledge that there are many adults mainly belonging to risk group that are difficult to reach, and so that's it's very important that you mention it. In the text, we have two tools. One is a dashboard to track national coverage, and the second one is the electronic vaccination registries. In the hepatitis B, let's say, field, we lack of data. We lack of data regarding the number of infections. We lack of data regarding the vaccination rates, and it's very difficult to get data from member states. So to compare also between member states. Do you think that these two tools can help to tackle the data issue?
Absolutely, yeah, and I think what gets measured gets done, isn't it? As I that's where I think with the Europe Speeding Cancer Plan, one of the great strengths, for example, has been the creation of an inequalities registry. It's tracking where we're at on screening, where we're at on prevention issues, and it focuses the mind, and it brings a welcome sense of accountability for member state countries as well. So I think once you set the goal, as one would do through this council recommendation, then it follows that some systems have to be put into place. And something we've advocated around the European health data space, for example, is we know that the health data infrastructures across Europe vary quite a lot, and it would be a legitimate use of EU funding, we believe, to help support some countries boost that infrastructure in just the same way as you would help support a country boost their transport infrastructure. So too their health data infrastructure is rewards investment and pays off, so we should be helping.
Yeah, is there something you want to add?
No, all good from my side, really.
Okay, thank you. I will probably make a switch because I see that time is running out, so maybe after Alessandro, maybe I will involve Marco. But let's continue focusing on the European Beating Cancer Plan that has been mentioned many times. But let's consider the European Beating Cancer Plan from a different angle. So the non-communicable disease one, we know that they account for the 90% of mortality in the World Health Organization European region. A significant proportion of the burden disease is preventable and is very much related to risk factors such as tobacco, alcohol use, unhealthy diet, and physical inactivities. The cancer plan contains an extensive list of initiatives related, to tackle these. That shows a huge commitment, at least an initial commitment by the Commission. If we check the progress of the implementation of these initiatives, we see that the roadmap is topic have not been met to date. So many are delayed. So Alessandro, what is missing? And from your point of view, how can civil society association like push the European institution to implement and really work on this and not leave this topic behind?
Yes, for the invite. Thank you for having this discussion, and also thank you to the ELPA team for being this active on this. Really important. I think last time we met in person a month ago at the European Commission when we were celebrating the midpoint of the roadmap of the EU Beating Cancer Plan, and as you said, this was ambitious effort to the European history in health, the launch of this plan, and it came with this substantial budget in 2021, and it came with a 5 years long implementation roadmap. And a lot has been promised on cancer, and as you mentioned, on all NCD. And why we celebrated what has been achieved, because I mean, of course, we had a lot of improvements in that area, but a lot of what has been promised has not been delivered. And this is a pity, because it's hampering the entire prevention pillar of this plan. But not only this, it's basically the entire plan's progress. Because from one side, to have the health goal and results that we are hoping for, and but on the other side, we're also helping industries profiting from the commercial determinants of health, for example, that are opposing to this goal. I don't want to enter in the specifics. I think we know more or less what is not being done. It involves the update of the legislation on tobacco products, the novel tobacco products. Everything about alcohol products has not been delivered, from health warning labels to nutritional values to ingredients list, as well as the entire, to tackle the consumption of the product, the advertisement of the product. So, as you mentioned, the nutritional value, healthy and sustainable diets. Richard, I see your hand is up. I don't know if you want to comment on this or at the end.
Well, just if it's okay, I know we're on time pressure, but I just wanted to offer a counter view to Alessandro a little bit. I fundamentally accept the point that there are parts of the plan that have not advanced, but I would say it's a very broad plan with, I think, more than 40 different initiatives. I think everything where it's kind of not legislation has been moving in one form or another. What we've got is a problem with the political environment to get some of the things on food labeling, alcohol labeling, etc., over the line. And I just think that's a really big wake-up call for the health community in the run-up to this elections, that we've got to make sure that when the new parliament comes in, that it's a parliament ready to do big things on much of prevention policies. So it's a plan that I think has been falling back, and it's for political reasons, and we've all got a role to change that environment.
I agree with you. I think maybe we need another event and maybe more time to discuss this, because I agree with you, but the part that is not really going forward is the part that the political landscape works so hard on for the 2 mandates with the BECA committee, with the recommendation from the parliament, and it is a pity that of years after they promised so much in the plan, they are just like falling behind for not real concrete reasons, like they're just using some sometimes lame excuses for not delivering what has been promised, and it's not that them to promise this, it was their own initiative. So I agree with you. I think like our role, it's important here, but not to reinvent, to remind them what they committed to do and what they actually should do. But basically, in your question, Beatrice, you were asking me what the EU institution should do, and if I have a minute or 1 hour, I think I will. You will not hear me mention to cut 20% of the health. So we know, like a few weeks back, they announced 1 billion euros cut from the EU4Health program, and this is of course like compromising our ability to fight NCDs and cancer comprehensively in Europe, and also shows that basically not much has been learned from the painful and heavy lesson from COVID-19. So what we can do, institution could do, I think, like the priority is to basically recommit to plan the initial goal and time beating cancer plan. What the civil society could do, first of all, it should be involved not as a process but as an active contributor. We know now co-creation processes for this type of legislation is the norm, and we should be a key player in these type of processes. I really think that together, if you are really united, our voice is strong enough to not only affect and improve this type of policies, but also to influence agendas and work programs of the new commission, the new parliament that they will take office in a few months from now. Just to summarize, I think like Europe's Beating Cancer Plan, it can be the new golden standard on how health emergencies are tackled in Europe, but still like we don't see the full potential of this new ambitious approach. And I think in order to fix this, to leave this impasse, what we need is to a comprehensive, inclusive approach to the management of all NCDs in Europe, as it is stated in IFA's manifesto. We should resist and oppose budget cuts, especially when it comes to health of the citizens. And finally, I think we really must fight the industry lobbying, especially when we have this clear conflict of interest between private profit of known risk factors against people's health in Europe. And I think like if we tackle these three aspects, we can really manage to get a healthier and more equitable Europe. Yeah, thank you.
A lot of work ahead, I see. So I know that Marco Greco has another commitment. So, but we will stay on a kind of hot topic, and we will stay really, up to what's going on in the legislation. Because just a quick question about the EU pharma legislation from a patient perspective. Since it's been commission, I've been hearing like unmet medical needs, unmet medical needs, unmet patient needs. I think I have already listened to 10 different names to call, and it's been creating a huge debate because in the framework of the EU pharma legislation, there is this definition floating around. And my and our ELPA's feeling is that, in this huge debate, the opinion of the patients and the vision of the patient can be lost. So how can we keep patients and patient association at the center of this debate that is extremely important? Because on this definition, we are also building a huge piece of the pharma legislation that it's about, reimbursement money and so on.
Thank you. It's always a pleasure to be here and to work with ELPA and to take part in your initiatives that are always high-end. Although I should complain a bit about the fact that you always give me, questions that are not either neutral or at the very least, they're always a bit controversial or lead me to be a bit. But I think it's part of the role. The concept of unmet medical need is for sure crucial for our members. It's also a very good example of what it can be done, even with the best intentions, if you don't engage with patients at an early stage, because it is. We have unfortunately foreseen since the very first day, the first time we read it, we thought, okay, this is going to be a disaster. But so the definition per se has a far-reaching implication, for example, that go beyond R&D, not only from the company perspective. For example, it will form the basis for company eligibilities for regulatory data protection, conditional marketing authorizations, enhanced regulatory scientific support. But it will also have an impact throughout the post-authorization phase and during the HTA process. And this is the short circuit that we are particularly worried about. We are, of course, about the fact that the definition that it is included in the proposal, by only considering morbidity and mortality as indicators of unmet medical need, that would lead EU to ignore other important life-changing indicators for which, significant therapeutic improvements or even breakthroughs may be needed from a patient perspective, such I'm thinking about appropriateness of existing treatments or impact on quality of life. That is something I've been working on the last, I think, 25 years, and still it's an issue. It's important also, you mentioned these, to highlight the slippery nuance between the concept of high unmet medical need and unmet medical. It's evident that it remains vital to stimulate innovation in rare diseases and drive investment into areas that companies would not consider commercially viable otherwise. That's for sure. But currently, an estimated 95% of rare diseases patients do not have an approved therapy. The majority of rare disease licensed treatments are not curative and only manage symptoms or slow down disease progression. That is important, of course, but leading to continued high morbidity and mortality rates. These constitute unquestionably an high unmet medical need that has not been properly considered. Medicinal products that provide exceptional additional therapeutic benefits in disease that currently cannot be cured and are associated with high morbidity or mortality should also be considered as addressing an high unmet medical needs. And for the moment, we have no guarantee that this is going to happen. The concept per se, however, should also aim at distinguishing innovative medicines that bring real and added therapeutic value to patients from other, let's say, new medicines. This cannot be done without the in the process, because studies have shown that patients' preferences and priority often differ from those of the general public. It has patients' priorities may not be what the medical professionals or pharmaceutical companies think they are. So when identifying unmet medical needs of individual patients of particular disease area, the patient perspective is indispensable. assessing whether medicine meets an unmet need will require case-by-case evaluation and additional guidance by EMA based on genuine involvement of patients' representative in each specific disease area in this process. And this is a huge challenge also for the patient community, because it's difficult to find experts, it's difficult to train experts, it is difficult to play a role there if you don't have a high level of competence in doing this. APF has developed with our framework for a patient-centered definition of unmet medical needs. I thank ELPA for the contribution. We published a paper in October 2023 that outlines our key points. For the moment has been gently and kindly ignored, but it's we're taking any step back on this. We believe strongly that it has to be inclusive, it has to engage with patients, and that the following criteria should be considered when assessing patients' unmet medical needs. Of the condition on life expectancy after providing care treatment. Second, the appropriateness of care for patients. We should include considerations on the impact of serious outcomes that are not or insufficiently addressed, impact of the product on disease onset, progression, duration, and disease severity, of course. I'm thinking particularly about chronic diseases, impact on specific subpopulation, lack of availability of current standard of care in EU members, because we are still, let's say, undervaluing the fact that the EU as a common regulatory framework has a lot in common, but still we see patients going to another EU country for getting treatments that they cannot get at home. And there are huge disequalities in these. The impact, finally, of the condition on patients in terms of their experience and daily life after receiving standard treatment. In this context, we want to recall the importance of including patients' experience data, PAD, beyond traditional clinical endpoint at all stages of medical developments. PAD can play a crucial role in assessing whether and how a product addresses patients' unmet medical needs. So I think I've come to a conclusion. I'm sorry, but I'm very passionate about these. So I take the chance also once again to say thank you for this opportunity. It's important that we speak about this.
Do you have 1 minute? Sorry, this is totally out of the blue. But I'm ELPA to convey the message that morbidity and mortality was not even reductive. It was okay. We not talking. We even don't talk about that. But the idea of having a possible dimension made by different criteria and criteria that are not only strictly medical related, but are more societal related. And you mentioned, the burden on vulnerable groups. It's very important this for the liver patient. That's why I'm asking. For example, the productivity. If the answer that I always got back is this is a pharma legislation. So societal criteria is complicated because this is a pharma legislation. So this idea of working in silos, I have the feeling that it can be very dangerous for patients.
It is. I completely support your point of view on these. Also because the experience of engaging with patients in pharmacovigilance, for example, shows very well that you cannot avoid to have a more holistic approach to the issue, because our choices as patients are also led to by certain criteria, by certain items that are not. I mean, I remember it's a bit like when we had this discussion once about at the very early engagement of patients in pharmacovigilance. No, it was said, okay, but patients are very often driven by emotions. I even wrote an article on that. And so it's part of the game, because if you don't match also that part, the risk is wasting resources. The risk is very high under many other issues. I mean, it's the overall patient's experience is essential. If this legislation, as it was said, is there for leading to a better healthcare system overall in Europe, with a better use of resources, with a better access, then, I mean, even stopping at these two, that are the first two things that they tell you, no? Better use of resources and better access. But you cannot have those if you don't consider also other things. And what is a bit strange, I mean, here, it's that indeed, I don't believe that what is happening is really what they had in mind. And we had the demonstration at the beginning of this meeting when Meb Sokol made a very good point on prevention. No, okay, I don't work very much on prevention as a PF, but thinking, for example, about ELPA, I would say much more than prevention, early diagnosis for liver cancer is a disaster. It's still a huge problem, no, because it's silent and so on. If you don't consider this part properly, you will lose a lot of potentially important items in the discussion. I give you this example. The social stigma about liver diseases, it's still a huge obstacle for an early diagnosis. That's evident. And so if you want to develop a better drug for this, you have also to consider that part. You have to consider that this drug will be used probably not in the optimal framework that is there. And it is because the system is somehow not open enough to understand these patients. And with this, I would like to make a final point on myself, then I promise I will shut up. In this particular day, although I'm not an expert in this area, I would like to strengthen the point of your campaigns about checkups, about the importance of following controls in order to have an early diagnosis. I think it's a great work that you're doing over there, particularly in the less developed countries. And it's an example for many other patients' organizations, what ELPA is doing in that direction. So thanks.
Thank you, Marco. And now let's put our boots on the ground, because we cannot overlook the dimension of the national level. I mean, together with Richard, we mentioned member states, and the role of civil society organization at national level. So regarding a member state like Malta, and I am addressing Gertrude, what initiative is the Malta Health Network currently undertaking to raise awareness about cancer and early detection? And how is the network, the Malta Health Network, collaborating with the other stakeholders, so healthcare providers, other organizations, communities, to improve the cancer care and the support for patients and families in Malta?
Good morning, everyone, and thanks for inviting me for this interesting event. I am honored to represent the Maltese community. Unfortunately, I have to say it up front that we do not have a liver cancer organization in Malta yet set up. We're working on that. However, the only consolation of this is that everyone tells me the numbers are very small. So either we are not detecting or we are doing very well. In preparation for this event, I looked a bit what legislation or strategies we have in Malta. And I was pleased to find that we have a national cancer plan, which expired in 2021. We have a national healthy weight for life strategy, which expired in 2020. We have a national alcohol policy, which expired last year. And we have a healthy lifestyle reducing obesity bill, which passed the Maltese Parliament in 2016. So with regards to policy and legislation, probably we tick many boxes. But how that is reaching society is a big question mark. Another positive thing, which I know I confirmed yesterday is that we have hepatitis B vaccination included free in our national vaccination program as from babies from the age of 2 months. So we have practically 98 to 99%. I won't go into the 100%, but we have well over 90% of our children from the age of 15 years under, all vaccinated with Hep B vaccination, which I think is something which is very positive. Apart from that, I know that from 2020, all persons who were Hep C patients are being offered free treatment. From the national system, the only condition is if they were drug users, they would have to have stopped using drugs. So I think with regards to preventative measures as vaccine goes and treatment, maybe that is a tick for Malta. And maybe that could be a case study to look into Malta when it comes to the justification for reducing the costs, not just financial and economic, but also from a patient burden perspective of dealing with illness, which can be prevented through vaccination. So that would be one of the things which as civil society and professionals we could work on by looking at the evidence from Malta. Maybe we can't have a liver cancer association, because we are doing so well at prevention that our numbers are very small, close to nil. I hope that that is the case. If that is the case, please let us look into this and use this evidence for other countries. The other thing that as a Malta Health Network we are doing is that we are active on the National Cancer Platform. This is a platform which brings together 11 cancer-related organizations. Unfortunately, I must repeat, not liver cancer, but there are the rare diseases, which are the rare cancers, and these are also very important for us. As rare as it can be, one patient is significant to us. So whatever we can do to reduce the burden for these patients, we will do. There is also the aspect which was mentioned earlier of access to treatment. And if I were to find a big problem which we have in Malta, is this: access to treatment. There are financial issues. There are the economics issues of numbers, where we know that there are certain companies who think that the population of Malta is so small that it's not worth economically sending medicines to Malta. And this is a very big, sad moment for us if we have patients who have to face this reality. So what we are doing as Malta Health Network, we have just, it's not yet public, but we have compiled a policy document in collaboration with our members. We have presented this to our new health minister, who is very open to the discussion. And we are looking at collaborating together so that we go from policy and legislation to implementation. And the two areas which we hope to start tackling with immediate effect are work on obesity and access to medication. This is still a discussion at table, but at least we are there on the table. And I would like to conclude with a phrase which I heard a few weeks ago at a WHO meeting, which I'm borrowing. I know our health minister really liked it, and I want to share it with you, that we have to be active and not reactive. So like that, we know that our investment will truly bear fruits. And if we can reduce the burden of one patient, we are there to do that. Thank you very much for this opportunity to share with you.
Thank you, Gertrude. Always words of hope from you. And it's always good to hear that from the patient community. I kept the Lily at the end because I would like to kind of close the circle and get back to the first topic we touched on with Marco, that is inequity and inequalities. And also, it's very, it's perfect to close with you, because Gertrude also mentioned a Malta problem in access to treatment. So DICE, with the support of ELPA, among many other associations, has launched the Liver Cancer Index, that is an interactive map that highlights the liver cancer treatment landscape across the EU. I know that there are some interesting fundings. So if you can just give us an overview of these fundings.
Yes, first of all, thank you for inviting me, and thank you for this very relevant question and the opportunity to give you a brief overview of our findings. So unfortunately, our results from the Liver Cancer Index reflect significant disparities in liver cancer treatment and care across the EU. And there are also several major aspects where the member states do not meet evidence-based recommendations. I will just list a few of these because I also know we're running over time already. So first of all, the clinical practice guidelines from the European Society for Medical Oncology and the European Association for the Study of the Liver provide very clear recommendations on best practice care defined based on the Barcelona Clinic liver cancer staging system. However, we found that not all participants were familiar with these guidelines. And in 19 out of the 24 participating member states, own guidelines exist, but also not all participants were aware of these. So it would be essential to increase awareness of treatment guidelines. Furthermore, multidisciplinary treatment is not accessible to all liver cancer patients across the participating member states, even though we know that multidisciplinary treatment is widely recognized as a best practice approach in cancer care management and is also associated with improved survival rates. Also, the concept of expert center certification is known to contribute to better quality of care and better patient outcomes. Yet, in half of the participating member states, there is no certification system for accrediting hospitals or clinics as expert centers for liver cancer. Our findings also suggest that liver transplants in liver cancer patients are not regularly performed across all the participating member states. And in most of the member states, the transplant waiting time is over 6 months. Accessibility to liver cancer transplants should be improved. And living donor transplants are also not performed in about half of the participating member states. And this option should also be made more widely available, in our opinion. In 11 out of the 24 member states, only some European Medicines Agency, EMA, approved systemic therapies are accessible and fully reimbursed. Liver cancer patients in advanced stages of their disease should have access to all EMA-approved systemic therapies. And one final point is that quality of life, which is an often neglected but critical aspect of patient outcomes, is, except for in 2 member states, not considered, as in quality of life questionnaires are not used, or if they are used at all, only in clinical trials. So, as you can also probably see, there is a necessity to improve the status quo. And I believe that the way we can achieve that is if all of us are active in the field of liver cancer advocacy work together to raise awareness about the current situation, and we must approach policymakers with unified, clear messages regarding the necessary changes that have to be made. And I think last year's shared social media campaign, which was co-created by 5 organizations, ALPA, ILCA, EASL, ILCM, and DICE, is a great first step in this direction. It is also important that we set clear priorities and choose specific areas to focus on when we are advocating for the key changes needed in the field, so that we can improve the status quo step by step. And for last year and this year, our organizations have decided to focus on the importance of screening and early diagnosis, since, as was also mentioned earlier, the earlier liver cancer is detected, the better the patient's prognosis. And also, it is easy to infer who is at high risk of developing liver cancer. And this is why this year, DICE will expand the Liver Cancer Index to also include data on the status quo in prevention and diagnosis of liver cancer. And finally, when it comes to improving the current situation in the field of liver cancer prevention, diagnosis, and treatment, we must not forget the importance of working towards change, not just on a Europe or EU-wide, but also on a local level, so as it was just mentioned. And this is why DICE regularly hosts national advocacy events in collaboration with our member organizations, and why we are now using also the country-specific results from the Liver Cancer Index. These are being translated and utilized by our member organizations.
Thank you, Lily. A lot of work to do also on that, on that front. Marco, the floor is yours.
So thank you very much. So prior to the conclusion of our roundtable discussion, we will see also a contribution from 3 members of the European Parliament. So Blanco Iban and Semedo and Mahova, and we will see their contribution now.
Hello everyone, and thank you for your invitation to this interesting online roundtable on the challenges and unmet needs faced by liver patients. Even though I cannot join you today, I did not want to miss the opportunity of addressing you and saying a few words. Despite not working on health policy in my role as MEP, I am well aware of the paramount importance of cancer and liver conditions in nowadays society. Last February the 4th, the World Cancer Day reminded us of the imperative need of acknowledging the global impact of cancer. This disease exacts a heavy toll on individuals, families, and healthcare systems worldwide, stressing the need for action at the European level. The European Union has demonstrated its commitment to beating cancer through the European Beating Cancer Plan, a comprehensive strategy designed to address cancer in all its forms. This plan takes a holistic approach, encompassing prevention, treatment, and care, and it reflects our collective determination to confront this big challenge head-on. Within the framework of the Beating Cancer Plan, there is a specific focus on liver cancer. Recognizing the unique challenges posed by this disease, we must implement targeted strategies to combat it effectively. This includes prioritizing prevention through lifestyle interventions and vaccination programs for hepatitis B, a significant risk factor for this type of cancer. Early detection is paramount in improving prognosis and survival rates for liver cancer patients. Thus, we must invest in screening programs and innovate diagnostic technologies, ensuring accessibility for all citizens. By detecting the disease in its early stages, we can not only save lives, but also alleviate the burden of healthcare systems. We should also point out at the existing disparities in healthcare access and outcomes related to liver cancer. It is imperative that we address these inequalities, guaranteeing equal access to preventive measures, screening and high-quality treatment for all citizens, regardless of their socioeconomic status, since access to high-quality healthcare should be a universal right. International collaboration and research are key in the fight against liver cancer. By sharing information and resources across borders, we can accelerate progress in prevention, treatment, and addressing disparities. Increased funding for research into liver cancer is essential to drive innovation and develop strategies that are more effective. To sum up, it is important that policymakers and the stakeholders actively support and implement the measures outlined in the European Bleeding Cancer Plan. We need to make sure that there is an accurate allocation of resources and master the political will to make tangible progress in the fight against liver cancer. Together, we can make a difference and build a healthier future for all Europeans. Again, thank you so much for your invitation, and I hope you enjoy the fruitful debate ahead.
Cancer is a critical health issue that affects the lives of millions of people worldwide. And we are aware of breast cancer or colon cancer. But what about liver cancer? Liver cancer is not yet in our minds. But liver cancer is the 6th most common cancer globally and the 4th leading cause of cancer-related death worldwide. So what to do? As politicians, we should raise awareness, of course, awareness about prevention. A healthy lifestyle is already the best prevention to do. So no excessive consumption of alcohol, prevent obesity, and of course be protected from cancerous products. Another important thing is the early detection. So regular screenings of the liver is crucial, as I did when you were here in Brussels near the Parliament with your car for early detection. That was a good initiative. So it's important to ask regularly to your doctor to do or to prescribe such a screening to prevent liver cancer, because it is a silent cancer that doesn't manifest really, it doesn't hurt. And that's the dangerous thing about. So we have to prevent that and raise awareness. So we also, as politicians, we should push for the European Cancer Action Plan to be put into reality. And that's what we do. And also what we can do as politicians is to support the network of those who want to raise awareness about liver cancer. And another thing is also very crucial. Research, especially when it comes to liver-related rare diseases who affect also many children. So research is key here in order to save their lives. And that's why I'm very thankful. You are so active and I keep on supporting you. And let's stay healthy, let's do screenings of our liver and enjoy life and fight for those where life is in danger due to liver cancer or liver diseases. Thank you for your support.
Ladies and gentlemen, today we gather to address a matter of profound importance, the challenge of cancer. The numbers are stark. The impact is profound. In 2020, almost 3 million people in the European Union receive a cancer diagnosis, and more than 1 million lives were lost due to cancer. Europe, representing just a tenth of the world's population, bears a quarter of global cancer cases. As a member of the European Parliament, I am honored to address you today on a matter that demands our immediate attention: liver cancer and the European Union's efforts to combat it through the European Beating Cancer Plan. First and foremost, I want to express my gratitude to the European Liver Patients Association for their tireless dedication to promoting the interests of people with liver disease on the European agenda. Their commitment to this cause is truly commendable, and I am proud to stand alongside them in our collective fight against liver cancer. In October 2023, they witnessed the tremendous success of the European Liver Screening Week event in front of the European Parliament. It was a powerful reminder of the impact that collective action and awareness-raising initiatives can have in addressing pressing public health issues. However, our work is far from over. As we approach the European elections, it is imperative that we prioritize preventive measures for overcoming liver disease. Prevention is not only more effective, but also more cost-efficient than treatment, and it is our moral obligation to ensure that all European citizens have access to the resources and information they need to protect themselves against liver cancer. The European Beating Cancer Plan, initiated by the European Union, represents a significant step forward in our against cancer. This comprehensive strategy aims to address the entire cancer continuum, from prevention and early detection to treatment and survivorship. It emphasizes the importance of collaboration between member states, stakeholders, and civil society to achieve its ambitious goals. In line with the objective of the European Beating Cancer Plan, ELPA is organizing this roundtable discussion to raise awareness about liver cancer and address the challenges faced by liver patients. The European Union's commitment to tackling cancer is unwavering. Did you know that the EU has allocated significant funding of €4 billion to support initiatives addressing cancer, reflecting our determination to make a meaningful impact? Through initiatives like the European Beating Cancer Plan and the collaborative efforts of organizations like ELPA, we are making strides towards a future where cancer is no longer a death sentence, but a manageable condition. Let us reaffirm our dedication to this cause and work together towards a healthier, cancer-free Europe. Thank you.
As we conclude today's enlightening roundtable discussion, I wish to extend my deepest gratitude to each and every one of you that made an invaluable contribution to this topic. Your insights, expertise, shared experience, they have all illuminated the path forward to a more effective prevention strategies against liver cancer with the framework of the new European Parliament mandate. And let me say, like, we are active, not reactive, as Ms. Buttigieg said. Today, we delved into critical role of prevention in fights against liver cancer, and we highlight the necessity of European Beating Cancer Plan, and also the necessity to stay focused on issues that are closely connected to health, just not to lose them in the next period. So we are still exploring the innovative strategies that can significantly reduce the incidence of the disease. As we heard from Lily, DICE has done like liver index, and they will expand the liver index to include even more data in that. And from ELPA's side, we are doing roundtable discussions, publishing scientific papers that are showing that we really need to be active in this field. So this collaborative spirit demonstrated today is exactly what is needed to drive forward the policies and initiatives that will make a tangible difference in the lives of those that are of a risk or are battling liver cancer. So as we move forward, let us carry on these insights and commitments and work even closely together in the next few years and in next new mandate, because together we have the power to influence policy. If you remember, we have changed the text of European Beating Cancer Plan, which was a huge step forward. We have the ability to mobilize the resources that are important to make this change and to implement effective prevention strategies that will save lives in the European Union. So let this roundtable serve as a catalyst for continuing dialogue and action. Thank you once again for your dedication and for joining us in these vital missions. I'm sure that we will look up where you are, and we will invite you to many more roundtable discussions and events that we will have in the future. But thank you very much for your contribution today.